Welcome and congrats! You have found the MMAC Minute Podcast, where Shar, RN and owner, and Mallory, NP and Medical Director of Montana Medical Aesthetics Clinic, hence the MMAC, take a little dive into the world of aesthetics. Join us as we discuss hot topics and timeless truths. We will be your guides to navigating your own aesthetic journey.
Welcome to the MMAC Minute. I'm Shar.
I'm Mallory.
And today we're going to be talking about tattoo removal, laser tattoo removal specifically. Yes. Before we get started, we just want to thank you for joining us. And please like this video. Please share this video with your friends. And please subscribe to our video.
Please do.
And if you really want to help us out, give us a comment at the end. Thank
it.
you. So are there people who are a better candidate for laser tattoo removal than others?
Sure. So we always say the best candidates for tattoo removal are older tattoos. They are going to fade faster and easier. Black tattoos tend to fade better. And black older tattoos in certain areas of the body where there's higher turnover of our cells naturally. So like your hands, we're washing our hands, we're always sloughing skin off of our hands. Those just turn over faster. So they heal faster. And if you notice like certain areas where tattoos will fade quicker than others, those will do better with laser tattoo removal anyway. That being said, we can treat most tattoos. I was surprised when we started that most of the tattoos that we did were actually cosmetic eyebrow tattoos. I mean, like a majority. Since then, it's kind of evened out, but it was really funny that it was like, okay, yeah, we can do those too. Lots of rings.
Fun. But I just want to back up just a second.
Sure.
The word older, the term older is vague, right? What do you kind of mean?
Well, because every tattoo is like a snowflake. They're all different. A tattoo on you is going to do different than a tattoo on me, even if we got them at the same time. A tattoo with certain ink or the depth that it was done, or if you had scarring from the original tattoo, there's so many things that go into it. So we give like best guesses of how long it's going to take, how many treatments, but everybody's different. And I mean, we say that with all the treatments that we do, we always individualize them, but nothing more true than tattoos. It's just,
Right, because your artist could be a little heavier handed. They, some of the older inks are actually easier because they're not meant to be as permanent, or they weren't as good to be as permanent as they are now. I mean, a tattoo is meant to be there forever. It's that's the hard thing, and that's when people go to remove them. It's kind of, that's one of the conversations we have to have, is that
realistic expectations,
right? Because this tattoo was placed there forever. It wasn't supposed to go anywhere. So and actually the newer generations of inks are actually better at that than the older ones.
They stick around.
Right. What would make somebody not a candidate for a tattoo removal?
So there are very few that we would say like that we would never do. I don't plan on doing any eyeliner tattoo removal. Don't ask me to put titanium eye shields in your eyes. I don't want to do that. And always, obviously safety is our first concern. So those for now are out the window. I won't do tattoos on sunburned skin.
Yeah, there you go.
Think of it this way. We are introducing a controlled burn wound to your skin. If you already have a burn wound and we're putting a burn on top of a burn, that's not going to go well.
Yeah.
That's not going to go well.
Yeah.
So just like other lasers, we have to take those safety precautions.
Right. So you don't want to add a burn to a burn.
Right. And, certain areas are going to hurt more than others. So that's always something I try to talk about. Like, there are areas. How sensitive was this tattoo when you got it? Because we're about to do like a lot more treatments of that same area.
So like a direct reflection of how it might feel.
Yeah.
That's and it's not just the needle poke that you would feel. It's actually going to be
the prolonged burn of the laser.
Yeah. So that makes it a little bit more uncomfortable, or a lot, depending.
Yeah, depending on several factors.
Where it is. So let's talk about eyebrows a little bit, because they're kind of fun.
They are.
They've been the most variable for
That's
you,
true.
right?
The most unpredictable. Oh my goodness.
Yes, and the other thing is, like, because they could look black or brown.
And they'll turn colors.
Baseline color could be,
who knows?
What's been the most fun?
Two of the funniest ones, and I say funny now because we can look back on them. I've looked back on them with the patients, and we have had a good chuckle about it. It's not so funny if you don't know that it's coming. So I've been able to warn people now, like, listen, we don't know what color this is going to turn. So actually there's three of the funniest colors. So number one, we expect that your hair is going to become hypopigmented. So I will bleach your hair. You will have white eyebrows. Yeah. So imagine
if you have eyebrows underneath that or over that tattoo,
they turn whitish.
Yeah.
So
Santa Claus.
Yeah, like white. Yeah. White. So that's always like an expected. You know, if you have dark eyebrows, you'll get little white spots in them. Not to worry, once that's healed, you can cover that with makeup until, our next treatment.
And the color kind of comes back pretty quickly.
Yeah,
to the
it really
eyebrow.
does.
Or to the eyebrow hair.
Yeah.
Yeah, it's kind of stuns it. And
it's
kind
temporary.
Of,
but it's like shockingly white on somebody who has really dark hair. And then pretty soon it's back to normal. But that was funny. The other colors I've done brown and had it turn hot pink, which I thought after one, right? After the first treatment. And I thought maybe when they told me, I thought, hot pink, is it really hot pink? And like, send me a picture. And I'm like, is it the color? Is it like the camera that's distorting? No. When she came in, it was very pink.
Yeah.
So we joked about that. She had, she was a good sport about it, but it was really funny. It was like, okay, you can totally cover them up, and yes, I will do it again for you as soon as it's totally healed, so you don't have to keep going on with this. The other colors, I've done like a blonder, like a light brown, and it's turned like neon green.
I didn't even know about that one.
They're you just don't know because the cosmetic tattoo ink is so different, and there's so many kinds of pigment in there.
I do know that about cosmetic tattoos. They'll try to blend a number of colors together to get closest to what your natural color is or whatever.
How complicated it is for your hairstylist to get your exact color. And
so
to mix
who knows what they put in.
It's interesting.
Yeah, a little bit of that and a little bit of this and a little bit of that.
And a little bit of surprise.
And so that is the unpredictable nature of it. And there's no way to determine that. There's no way to know what that's going to happen beforehand.
I will apologize to our first eyebrow tattoo removal patients because during our training they told us to put the dressing on after to do Aquaphor and gauze. So I sent a lot of people out with a white unibrow and I'm sorry. I've learned since then that we can use Saniderm and it's a lot more normal looking, a lot less distracting when you inevitably have to go to Costco right after you come in and get your eyebrow tattoo removal done.
So what is Saniderm?
So Saniderm, thank you for asking, is a clear adhesive dressing that's commonly used to put on over tattoos to help them heal. And we can use the same thing
for post-laser.
And it really seems to help the tattoos heal faster. It keeps them covered and it's very occlusive. So rather than having like Aquaphor leaking on your clothes,
it's like a layer of protection, so things don't feel quite so tender.
Right. It protects, so you can put clothes on over, or and it doesn't, peel off as easily. It's just easier. Yeah.
So I know where I'm leading you with this question. We'll see if you pick up on this question.
Trick question.
What is sometimes the most difficult part of treating tattoos or telling somebody about talking to them about what would be the ideal time frame and spacing and that kind of thing. So what's the most...
So realistic expectations I'm going to circle back around to that because I tell people now, like you said, tattoos were put there with the intention of being permanent. So the fact that we can even lighten them a lot is like miraculous. And the fact that we can sometimes get to the point where you can really barely see anything at all until you look really closely, that's a miracle. So what we're going for with this is to lighten it so much and obscure so that you cannot see what the original tattoo was, and that it's just very, very light. So for me, I tell people if there's any chance that you're thinking about getting this covered, look into that, come up with something, work with an artist, because if you are going to cover it and we're just lightening it, that is like chef's kiss, ideal scenario, because then you're not going to be left with anything behind there. There's always a chance that you're going to get ghosting left behind, so that, we have this original, really intense, really dark tattoo in contrast with your skin. And if we lighten that enough, great. I cannot promise. I would never promise that it will look like virgin skin, like it was never there in the first place. That's just, that's not a realistic expectation. So unfortunately, that's as far as we've come with laser technology, is that it's great. It's really, really good at lightening. And eventually your skin will continue the process of breaking it down.
Right. It'll
fade.
continue to push that pigment out.
Yeah.
And kind of, I probably didn't ask the question correctly, but...
Or I went wherever I wanted to go with it.
It's one of those things that by the time you actually pull the trigger and call us and schedule an appointment, you've probably wanted that tattoo gone for a while. I mean, you've been thinking about it probably for years, except for those people that come in 3 days later and want theirs gone. Yeah. But for the most part, you know, a long-standing tattoo, you've probably thought about it for a long time, and you're like, yeah, and just by the time you make the appointment.
Time frame.
Yeah, and so what we know is we can safely treat that tattoo again as soon as the skin is healed, right?
Yeah.
But it's not necessarily the best bang for your buck to do that.
True.
Oftentimes, because we know that the skin our skin will continue to push that ink out, you often will need fewer treatments if you push them out to about 12 weeks apart or so. But people can be very, very anxious and be wanting to really get, you know, that tattoo treated really quickly. So it is safe to do as long as the skin is healed.
Yes.
But it's not necessarily going to give you faster results.
Right. So what I tell people as far as the time frame goes, just to give a general overview, it's usually about 8 to 12 or more sessions, and then about 8 to 12 or more weeks apart. So if you calculate that out, that we might be friends for a couple of years, depending on how you do this. And by all means, I understand, you know, it's your body. If you have a tattoo that you really don't love and you feel like you're going to be stuck with it forever, that sucks. So if you, like, I'm all for I'm very practical. If you're like, I want to do it as soon as it's healed, I'm like, okay, we can do that as long as we're on the same page and we know what healed means. If you've got any flaking left behind, that is not completely healed. Not completely healed. So I'll do them as soon as, you know, some people are healed at 4 weeks, especially in the beginning of our treatment plan. That can happen. For most people, it's going to look more like 6 to 8 weeks, and sometimes even then not. So everybody's an individual, and I go over and over and over, you know, we talk about it's got to be healed. If it's not healed, just call me and cancel your appointment. I will understand. We'll reschedule. But
and we get it too. I mean, there are some tattoos that have some emotional ties.
It can be,
and it can be really therapeutic in our head to know we are actively working towards getting rid of those tattoos also.
Get it.
So it is more than just a physical thing, and we understand that, and that is really why we will work with people. And
as long as it's safe, we're all about that.
And even if we know that, you know, things would be better not better, but more cost effective potentially, and fewer treatments to have the treatments further apart. There's a lot. There's a lot
that goes into it. So working together, that's how we come up with your individual treatment protocol, and that's how we do that.
So like we said, different areas of the body have different expectations as far as number of treatments, spacing of treatments,
expected sensation.
Right. I was going to say, discomfort, healing, that kind of thing. So the best thing to do is, you know, give us a call. One of us can talk to you about it and what it entails and what the expected cost is. Unfortunately, it is more expensive than your tattoo was.
Yeah. That's actually what I've told people. I've talked with them a couple times, and like, I don't even think I'll tell my kids, like, don't get a tattoo till you're 30. I'd be like, listen, whatever your tattoo cost,
if something happens and you don't like it,
and you have to remove it, it's a journey, is I think what I'm going to get at. Like, you think you're going to love it forever, and you might, but the only way to know is to, like, give it some time. Sit with it for a while. So that's my spiel. And, you know, it's funny because I always tell my clients too, I have a giant tattoo on my side, the koi fish, and I got it when I was 19, and I knew I was going to love it forever. I do not. I do not still love it. I have made improvements, And the I'm not going through the process of removal for that. I'm just not. So
it is what it is.
It is what it is. And not that I would discourage somebody from moving a tattoo that they really want to remove, but for that one, it's just like, I don't even know how many hours that would take to remove.
Yeah.
It's just not worth it for me.
And the area.
It's very sensitive. It was sensitive to get, so I know it's going to hurt to remove. So all of that goes into play. But anyway, I would never judge you, is what I'm saying.
And I don't have any tattoos, but I know because I don't like anything long enough. And I know that.
I think we should vote what tattoo Char should get. So leave a comment about
I just can't. That's the other thing. I would never be able to make up my mind.
I'm going to vote for a tramp stamp. That's it. I said
I think if I was going to get one, it'd be a syringe.
There you go.
Right?
There you go.
Be a syringe and needle.
Yeah.
I mean, right?
That's good.
Yeah.
That's good.
Because I love to inject, I knit, and I sew. There you go.
There you go.
Yeah. So my whole life is needles.
Oh, that's a cute little leaf
I
tattoo.
know. Yeah.
Okay. One other thing I was going to bring up was like aftercare. A little bit of aftercare. So we talked about the Saniderm dressing. We do also, this is laser, so we want to keep the skin protected from the sun afterward. So that's a huge thing. So by all means, if you're going to come in and get your tattoo removed, that is one thing that I tell people: do not have color on your skin, do not have a sunburn,
or artificial tan,
or spray tan, or bronzer. None of that. The laser can't tell the difference. It will burn you. So just keep that skin nice and protected from the sun, and we'll see you for your tattoo removal. Let us know what questions you have, if any, or what you think what tattoo you think Char should get and where. I really am curious to know what people think you should do. All right, anyway, thank you guys.
All right,
bye.